Hello and welcome to SRG's Medicine. Today, in this series of respiratory medicine, we shall be continuing our journey with cough. So, the contents of this video are: we shall start with causes of cough based on duration, and then we shall be interrupted by a few words on sputum, and then we shall again continue our causes of cough based on secretion, and then based on timing. After that, we shall be studying about your very own personal clinical skill box. And then ultimately, we shall be giving certain general tips and finally summarizing the video. So let's start on right away. So classifying causes of cough based on duration as acute cough and chronic cough. So the causes of acute cough are infection, allergy, irritant or foreign bodies, and any causes of chronic cough at their onset. So there are four things that is to be remembered in acute cough. That is infection, allergy, irritant or foreign body, and any causes of chronic cough at their onset. Now, classifying the causes of chronic cough, we can state that chronic cough can be classified into common and less common causes. So the common causes, or let's say just the most common causes, accounting for 2/3 of the conditions of chronic cough, is postnasal drip, followed on by tuberculosis, which is most common in developing countries. And in developed countries, asthma is the second most common cause. So the other causes include COPD, gastroesophageal reflux, and smoker's cough. Whereas the less common causes include bronchiectasis, lung cancer, drugs like ACE inhibitors and beta blockers, heart failure, and interstitial lung disease. So, interrupting by a few words on sputum. So, I have kept this here because it is quite important to understand uh, something about sputum before moving on to the type of cough based on secretion. So, sputum based on consistency can be divided into serous, mucoid, or purulent. So, serous sputum is a type of sputum which is clear and water-like. So, it is less viscous and easily movable. Whereas mucoid sputum is thick and slimy and it is highly viscous. So, talking about purulent sputum, it is actually a sputum which contains a lot of WBCs and it is yellowish or yellowish green, but sometimes can also be blue or black. As in the case of pneumococcal infection, it can be blue. Pseudomonas infection, it can be blue. And in the case of aspergillosis, it can be black. So now again, continuing with the causes of cough based on secretion. So the causes of productive cough are bronchiectasis, in which the secretion is excessive in amount, and mucopurulent. By excessive, I mean greater than 2 teaspoonful per day. Normally, the sputum produced per day is around 1 teaspoonful. But in case of bronchiectasis, it is greater than 2 teaspoonful, and it is also mucopurulent in nature. So the other cause is pulmonary edema, in which the sputum is foamy and pink tinged. Here, there's an image of a pulmonary edema sputum in which you can see the bubbles. So that is foam, and there's blood, which gives it pink tinged appearance. The other causes include rusty sputum include pneumococcal pneumonia and paragonimiasis. And if the sputum is foul smelling and tasting, then there is anaerobic infections. So here it is quite clinically important because any patient presenting with infection, a low respiratory tract infection, or let's say with pneumonia, we have to start on with empirical therapy. And therapy differs whether the organism is aerobic or anaerobic. If the causative organism is aerobes, then we give macrolides such as azithromycin and fluoroquinolones. Whereas for anaerobes, we give penicillin, amoxicillin specifically, which is more commonly used. So talking about other causes, which include bronchoalveolar carcinoma, producing excessive amount of frothy saliva-like sputum, and the causes of blood in sputum, or clinically also called as hemoptysis, are numerous, and these are worth mentioning in a separate video. So now moving on with the causes of non-productive cough. The causes of non-productive cough include upper respiratory tract infection, viral pneumonias, drugs such as ACE inhibitors, inhaled irritants or foreign body in initial condition, because later on these inhaled irritants or foreign body will cause productive type of cough, and also pleurisy, gastroesophageal reflux, left ventricular failure, interstitial lung disease, and lung carcinomas. So now continuing with our causes of cough. So causes of cough based on timing can be classified as nocturnal or daytime and waking. So the causes of nocturnal cough include heart failure, asthma, and obstructive sleep apnea. Whereas the causes of daytime or waking cough are numerous. Some of those are postnasal drip, COPD, smoker's cough, and most causes of acute cough. So here it's quite important to note the causes of nocturnal cough, because they can point towards these specific diseases because they are quite less in number as compared to the daytime or waking cough. So let's move on with your very own personal clinical skill box. In the last video, I had mentioned to you that in every cases of chronic cough, we must order a chest X-ray. So why was that? Because the causes of chronic cough can be numerous, among which there are few fatal conditions. And among these few fatal conditions, some of the condition produces abnormal X-ray result. That also specifically, they produce characteristic X-ray result by which we can diagnose the fatal condition. And these fatal conditions can be treated in most of the cases. So, as these fatal conditions can be treated and they are diagnosed by the help of abnormal X-ray result, so the chronic cough must always be followed by chest X-ray. The examples include lung cancer, heart failure, tuberculosis, and inhaled foreign bodies. Now, I had also talked about the other thing. That is, cough also has circulatory consequences. So let us understand how. So the circulatory consequences of cough is actually syncope and increased risk of heart failure. We shall see how it occurs. So during cough, there is increased intrathoracic pressure. So when there is increased intrathoracic pressure, this leads to compression of aorta. So when aorta is compressed, then there is increased workload on heart. That is, heart needs to pump harder. And when there is increased workload, then the cardiac output, or the amount of blood flowing out from the heart per unit time, is decreased. So when that occurs, there is decreased blood flow to brain as well. Now this will lead to syncope or fainting and risk of heart failure. Here, I would like to make it clear that in a normal individual, this decreased in cardiac output is counterbalanced by systemic vasodilation. So, when systemic vasodilation occurs, this cardiac output is maintained and thereby blood flow to the brain is also maintained. So, there is no syncope or risk of heart failure. But in the patients with heart conditions or other comorbidities, there is high chance of decreased blood flow to brain, thereby leading to syncope or risk of failure. Now, let's try to end this video with general tips. So the tip number one here, change in character of cough, whether that be duration, timing, or type of secretion or secretion itself, will point towards neoplasia or infection. Now the next tip over here is, it is quite helpful to classify the causes of cough. And note here that I've kept it in blue, which means it has quite important clinical implication, which I shall say in upcoming video. Now, the next thing is there are few red flag signs which point to the fatal condition, and these fatal conditions should not be missed. If missed, these fatal conditions can be disastrous for the patient. So these are the general tips for this video, and now concluding with this video with the summary. Causes of cough can be classified on the basis of duration, on the basis of secretion, particularly the type of secretion, and time. Whereas the chronic cough always warrants chest x-ray, because some of the conditions of chronic cough are fatal and treatable. And these conditions also produce characteristics chest x-ray, so helping in their diagnosis. Hence, chest x-ray is always a must in cases of chronic cough. And cough can also cause syncope and increase risk of heart failure in high-risk patients. So thank you. Hope you enjoyed the video. Please do comment.